Virtual Video 2, Disseminated Intravascular Coagulation. What is DIC? DIC is an underlying medical condition that is triggered by severe stress on one's body. It causes the body to excessively bleed and develop blood clots at the same time. DIC is defined by ATI as a life-threatening coagulopathy in which clotting and anticlotting mechanisms occur at the same time. A client who has DIC is at risk for both internal and external bleeding, as well as damage to organs from ischemia and microclots. What are signs and symptoms of DIC? The patient can present as tachycardic with hypotension, diaphoresis, and bleeding or oozing from sites of venipuncture or openings in the skin, mucous membranes, and GI and urinary tract systems. It is not uncommon for the patient to present with difficulty breathing, petechiae, and ecchymoses. What are 3 common risk factors for DIC? OB complications, sepsis, and malignancy. What are the expected laboratory factors of DIC? Well, the hemoglobin, platelet, and fibrinogen levels will be decreased, while the PT, PTT, and thrombin levels are increased. A D-dimer will also show as increased. What are 5 nursing interventions for managing DIC? 1, you're going to monitor for manifestations of microemboli such as cyanotic nail beds and pain. You're going to need to regularly assess these vital signs and the patient's hemodynamic status. Monitor lab values for clotting factors and changes of. Administer supplemental oxygen and use fluid volume replacement, preferably blood, platelets, or other clotting products. Medications that are commonly used will be heparin because it helps to prevent formation of micro blood clots and will help the body to not use up all of its clotting factors. What is the prognosis of DIC? The prognosis is greatly dependent on the underlying condition, how quickly it is treated, and how quickly it can be corrected. With prompt treatment, the prognosis is fair to good.